Honourable Speaker, Manitobans continue to wait countless hours in emergency rooms and even longer for necessary surgeries across all of our communities. Last month, multiple media sources reported wait times at Health Science Centre and St. Boniface Hospital, despite the upgrades, are continuing to go up. Some people have been waiting for over 20 hours and are even going home or perhaps to Halifax in between their waits. Does the minister think it is acceptable that people are still having to wait so long for emergency care 2 years since they formed government?
The Honourable Minister of Health, Seniors and Long-Term Care.
I really appreciate that question from the member from Tyndall Park. It is a really important one, and I'm going to answer that and just say no, it's not acceptable. Those wait times are not acceptable, and I think what's important for us to note is how we got here. You know, the challenges we're facing in healthcare weren't created overnight. We're talking about 3 major emergency rooms in Winnipeg were closed by the previous government. Hundreds of healthcare workers were fired. All of the expertise, the folks we had working in those ERs moved on to other jobs and career paths. Our government is doing the work of training those healthcare providers, reopening emergency rooms, and we have experts working with us to make sure times move in a better direction. Manitobans deserve quality health care at the right time and the right place. That's why we're working so hard to make those improvements despite members' opposition.
Time has expired. The Honourable Member for Tyndall Park.
Honourable Speaker, on September 15th, CBC reported that since the NDP formed government, the support needed for healthcare has not kept up with the demand. We now have more Manitobans than ever before having to wait longer for necessary surgeries, including cataracts and knee surgery. Many individuals are not even being provided surgery dates. Honourable Speaker, can the minister please share with the House how Manitobans can confidently have timely access to urgent care?
The Honourable Minister of Health, Seniors and Long-Term Care.
Again, a really important question from the member for Tyndall Park. We are doing more surgeries now in Manitoba than we ever have before. We have invested in more capacity in this province. We've added an additional 800 surgeries alone at Selkirk. We anticipated getting to about 676 this year. We are actually on track to achieve that 800 number in this budget. I recognize that Manitobans, again, are waiting too long. We're working very hard to build more capacity. We also recognize that for 7.5 years, the previous government was actually cutting, not investing in more capacity in our own province. We're also making sure that Manitobans who couldn't even get their names on a wait list, they were ignored by the PCs, are finally getting care. That's part of the reason why, it is the reason why we're seeing longer times.
Time has expired. The Honourable Member for Tyndall Park on a final supplementary question.
Honourable Speaker, nurses and healthcare workers have been very clear that burnout and staffing shortages are at crisis levels. The Manitoba Nurses Union President, Darlene Jackson, repeats the frustrations and highlights that the NDP government is going in the wrong direction for improving healthcare. I table this article now. This crisis is not new. According to MNU membership data, 117 nurses have left Health Science Centre since January, with 65% of them being voluntary resignations. Honourable Speaker, how has this shortage of nurses impacted the safety and well-being of Manitobans?
The Honourable Minister of Health, Seniors, Long-Term Care.
We have a net new over 200 nurses working at Health Sciences Centre. That is in addition to the over 900, so it's about 1,100, under 1,200 net new nurses working on the front lines of our healthcare system in Manitoba. Wow. And Honourable Speaker, it's not enough. It's just not enough. We're graduating over 1,000 nurses a year. We're training more nurses than we ever have in this province. We're training more healthcare workers than we ever have in this province. And there's more work for us to do, and we're going to keep doing that work because we know that when you have more nurses and healthcare workers standing shoulder to shoulder delivering care, healthcare improves, safety and security improves, and the outcomes of Manitobans get better. We know there's more work to do. We're committed to doing it, no matter what the PCs across the way have to say about it when they heckle in this House.
Right.